Hey, hello everyone, good evening, welcome. So hope all of you are able to see my screen and hope all of you can hear me. Can I have a quick confirmation, please? Wonderful. All right. So let's continue with our discussion. So we started with our interventions, correct? Maybe I can copy from here. So under the interventions, first initially we have started with the concomitant medication. Now we will proceed with your exposure and exposure as collected. So what is concomitant medication, guys? By this time all of you are comfortable with this, right? So what exactly it is? Any medicine other than or any treatment other than study drug. If the subject is taking any medicine other than the study drug or other than the study treatment, that will flow under your concomitant medication. This can happen, this drug the patient or the subject can take in because of two different things, either because of your clinical events, or it can be of adverse event, or it can be of your medical history, previous medical history. Am I correct? This is what we discussed for the concomitant medication. Now, now we are going to talk about your exposure and exposure as collected. And these two are primarily for what is going to be the exposure, right, related to your study treatment. So we are using the study treatment, right? We are going with the study drug, right? So the study drug related one. So the subject is actually taking the study drug, right? What is the exposure of this particular study drug on the subject we want to analyze, and that details will be part of your exposure and exposure as collected. You might be wondering, Murli, why do we have two different domains? Because both of them are dealing with the exposure of your study treatment, right? Or study drug only, right? Why do we have two different things in that particular case? Why can't we deal with only one, right? Generally, only one drug will be there. Sorry, generally only one domain will be there to treat this. But in this particular case, why do we have two things? Am I correct? You might get this particular doubt, right? Right? Now, there is going to be a minor difference between your exposure and exposure as collected. For now, just keep it in your mind that exposure is a derived data set, or it's a derived one. You can derive your exposure from your exposure as collected, right? Maybe at this particular point of time, it is going to be little complex to understand, but not too much of complexity, a little complex to understand, but we can overcome that in a while. I can say that it won't take much time. Over a period of time, we are going to overcome that particular one, and you are going to get a clarity on that as well. All right. So let's start discussing about what is the usage of this. Okay. You remember this one, right? Unblinded, unblinded, blinded. Maybe it can be single blinded, double blinded, triple blinded, whatever it is. But I'm just simply going with two things: blinded, unblinded. What do you mean by that? Anyone, can you explain this? Blinded, or you can also call it as an open label. Anyone, can you explain this to me? What is blinded and unblinded? Anyone? Okay, so let me go with that. Okay, unblinded. So we have subject, the person who is taking this particular drug. You have investigator or clinician, or anyone who is assessing this, or anyone assessing the clinical trial, right? So can I say that there are three parties involved here? Subject, you have investigator, and anyone who is assessing this particular trial. Okay, answer from Ankita. All known about everything about that. Wonderful. So in open label or unblinded trial or unblinded treatment or unblinded design, you can consider in this particular one, all the parties who are involved in this particular trial are completely aware of the drug, are completely aware of the treatment. They know what medicine they are taking. They know what treatment they are undergoing. They know what is going to be the composition of that. They know what is going to be the dosage of that. Every piece of information clearly they are aware of. Whereas the blinded one, that can be single, double, or triple blinded, where any of these parties or all of these parties are not aware of what exactly the treatment or what exactly the drug that they are going to take. Am I correct? These two are the two different things that are available. Correct? Everyone are clear with that, right? Now, to support these two methods, just to understand how the various collections that are happening, right? That is, to know all the details, of your blinded and unblinded designs, right? So your CDISC has introduced two SDTM domains, and those two SDTM domains are nothing but exposure and exposure as collected. For all unblinded stuff, it is going to be exposure. For all blinded related stuff, it is going to be your exposure as collected. Exposure is primarily a protocol defined. It is a protocol defined. That is, these are the treatment that you need to go in the phase 1, phase 2, phase 3, phase 4. These are the 4 phases. The phase 1, the patient has to take this particular medicine. This is the dosage. This is going to be the washout period. After that, this is going to be the second drug. Like this, everything is properly defined in the protocol. A protocol to defined stuff is part of your exposure domain. Let's say in the protocol, it is defined that the patient has to take the drug called aspirin, and this drug of 100 mg, the subject need to take it on every day. The dosage is going to be per day, once a day. What if the patient, due to negligence, patient hasn't taken this particular medicine on day 2? So let's say it is started on 15th of May 2022. So the subject need to take this up to 14th June 2022. This is the duration, 1 month duration that the particular trial is defined in the protocol. The subject has to take this particular medicine, this particular dosage for 1 month. But all of a sudden, right, on the 2nd or 3rd day, let's say on 17th May, the subject haven't take this particular medicine at all. He or she missed to take this particular medicine due to negligence or due to anything. These details will not be part of your exposure. Exposure will only say that as per the protocol, aspirin 100 mg tablet has to take on daily basis. Done. It's game over. If the subject missed to take that particular medicine on one of the days, those information, whatever is missed, what is missed, all this information will not be part of your exposure, but this information will be part of your exposure as collected, because you are collecting the complete information there as is you are collecting it. So can you differentiate these two domains now? So what is the need of these domains? These domains need is going to be, we want to know how this particular study treatment, or what is the subject exposure to the study treatment. We want to know that. This can be a blinded one or unblinded one. So all blinded things I will manage at the exposure as collected. All the unblinded stuff I will flow into exposure domain. All right. So then what else? Right. So these two are the things I want to know: the subject exposure to the study treatment. For this particular one, I'll be going with these two domains. Okay, we'll go with some examples so that you can clearly understand the difference between them. First, as usual, we'll go with the domain, we will go with the nodes, and later on we'll go with the examples and we can differentiate. Anything related to the study domain, or sorry, anything related to the study treatment, EX and EC, anything other than study, where it will go? Anything other than the study treatment, where it will go? Concomitant verification. Now you understand how your interventions work. Anything related to the study treatment, these two domains. For blinded one, for unblinded the other one. Anything related to the other than study treatment, any drug the subject is taking because of any event, either adverse or medical history or clinical event, that will flow under concomitant medication. Substance usage, just I'll give you the information now. So patient habits, is he or she taking alcohol or they smoke, all these things will go under substance use. So this is all about your interventions. Do you guys are clear with us? Can I have a quick confirmation so that I can continue with the definitions part, variable definitions? Questions? All right. Let's start with our understanding about these domains, because both of domains are very important. So we need to understand this a little, right? So whatever I have given right now, I just mentioned this here. So maybe you can see this. So clinical trial study design can range from open label. So what is your open label? Open label is nothing but unblinded, where subject investigators know which product each subject is receiving. Then we have another thing which is nothing but to blinded. Blinded is the one where subject or the investigator or anyone assessing the outcome is unaware of the treatment assignments to reduce the biases, or it maybe you can remove this. Correct? Now, to support the standardization of various collection methods and details, as well as the process difference between the open label and blinded studies, two SDTM domains based on the interventions, general observations our classes are available, right, to represent the details of subject exposure to protocol specified study treatments. Remember this, subject exposure to protocol defined study treatments, and those two are exposure, which is nothing but EX, and the second one is exposure as collected, EC. Right? Just for your reference, I'm just typing these two here. So what are them? The first one is going to be exposure. The second one is going to be exposure as collected. So why do we need this? I just have given those details here. So today, first we start with the exposure, then we can go ahead with the other one, EX. Exposure domain class notes. All right. So I just want to give a little more information. That's the reason I just noted down whichever is important or whichever is easy to remember. I just have given these details here. Okay. So I just have explained this now. Whatever I have explained, I just mentioned in the text form. And we also need to understand what is going to be the difference between these two. Correct? So, because most of the people are unaware of this particular one, still, there are a lot of confusion about this particular one. So just to avoid that particular confusion, I just have given some details. Maybe I can just copy paste this and then I can explain this. So for SDTM implementation guide version 3.2, the exposure domain should contain only unblinded data. That is what just now I mentioned, right? Unblinded data for study treatment that was administered to the subject presented in the protocol specified units. So instead of all this, you can simply say that you can write it upwards. What is this? The exposure domain should contain only unblinded data. That is what I have been talking about. The unblinded open label data will go to your exposure, right? Now, the exposure as collected domain can be used to collect the blinded data during the study for all administrations that are given, not taken or missed. What I have mentioned here, few cases due to subject, maybe here I have given this. The treatment is blinded, some of the information is missed. Whatever is missed, everything we are going to mark or everything we are going to note down under your EC domain. After the study is unblinded, the EX domain can be derived from EC. That is also mentioned here. It is a derived domain. The EX domain, it can be derived from your EC domain, because if you unmask your EC domain, which is nothing but your EX domain, right? Here you can see the SDTM implementation guide recommends submitting both EX and EC if necessary, though including EC is not required. You really no need to give all the details as per your EC, but it is recommended to submit both of them. That is the only reason we are going to discuss both of the lines. I'm just going to take a pass here and I'm open for the questions. So can you guys able to understand what I have mentioned so far? So clinical trials has two different studies, open label, which is nothing but unblinded, unblinded. To support these two, it introduced two domains, exposure as collected. What is the difference? Exposure domain is primarily for the unblinded, exposure as collected is for the blinded data. It also have information about anything that we miss or anything that we will not collect. Both of them will be there, right? So even if you want to derive your EX domain, you can derive directly from your EC. If you unmask your EC data, which is nothing but your EX domain, right? So your study implementation guide suggests both of them are necessary, though EC is not required. It is recommended to have. Clear, guys? Right? Now, I just want to give some more information, which is nothing but yesterday we discussed about something. This one. I forgot to mention this. Maybe I can use this particular one here. What do you mean by constant dosing interval? Because if you go with your yesterday's class notes, right? The first thing we talked about is when you talk about the nature of the data set, we use a term called constant dosing interval. What do you mean by constant dosing interval? I have expected this particular question yesterday, but no one have asked, but fine. A constant dosing interval can be loosely described as a subject taking the same medicine, same intervention is same medicine at the same dosage at the same frequency over a period of time. As simple as that. What is that? The dosage remains going to be the same. Frequency remains going to be the same. Over a period of time, the subject is taking this. You can see the example here if you like. Can you see this? Let's say all this is going to be the subject is going to be the same. Let me take this. Subject 111. The same guy is started taking this particular medicine, drug A, same dosage, same units, the same frequency over a period of time from 6/9/2017 to 8/10/2017. Can I call this as a constant dosing interval? Everyone? Guys, I'm just going with the examples as well, just to facilitate additional information so you can easily understand this. That is the only intention. If you guys are able to follow this, I'll be happy. So if anyone not able to understand it, or if anyone have difficulty in understanding it, please tell me. Otherwise, all the efforts will be waste. Okay, Raja, there is a question. We are giving some drug like oxybutynin drug. We are going those related information. We can treat a data set name is called exposure data set, right? Okay. We are giving a drug like oxybutynin drug, which we are going to use the related information. The related information means I'm missing that, Raja. What exactly are you talking about? Can you give little more details to me? Suppose if you are testing a drug, your clinical trials is intended to go with a treatment called or using a drug called oxybutynin. In that particular case, what your understanding is correct. Your study drug is that, and you are using that particular drug on your patients or your subjects. Then your understanding is correct. If oxybutynin is not going to be your study drug, then this information will go to your concomitant information because it will become a supporting drug. Let me know if you have a follow-up question on this. Any other? All right. Let me know if you have any questions. Okay, perfect. Now let's continue. So I just want to give this information before I start our today's class. That's the reason I have just talked about this. Now we clearly start with the exposure domain. Here is what our exposure domain. Okay, so let me start with this. There are a lot of variables which were introduced in this particular domain. So generally what we do is we don't go with all the domain, all the details, but we generally go ahead with the details that are required. But we will go with most probably all the variables and the labels we discussed today. Okay, so let me talk about it. What exactly it is. So what it regards, it captures, we generally write what exactly it is, right? It captures the details of subject's exposure to protocol defined. This is very important. Protocol specified study treatment. Whatever is mentioned in the protocol, that details how the subject is responding, those details it is going to capture. Simply, it will talk about, it captures the details of subject exposure to the protocol specified study treatment, right? Remember, the study treatment that we are talking can be any intervention that is defined within your study, right? Anything, any kind of treatment. Okay. What is going to be the nature of this? We need to understand the nature of this data set, right? So the nature of this particular domain is going to be one record per protocol defined or the protocol specified study treatment headings. One record per protocol specified study treatment. Again, we also need to talk about your constant dosing interval. Constant dosing interval per subject. This is remains same. Per subject remains going to be the same. One record per each protocol specified study treatment, constant dosing interval per subject. This is how the nature of this particular data set is. Okay. So now, as usual, we are going to talk about what is going to be a topic variable. Correct. So the topic variable here is going to be. Can someone tell me what can be the topic variable that you can expect here? Anyone? Wonderful, Priyanka. So Priyanka mentioned that it is going to be EXTRT. Yes. Yesterday we discussed about concomitant medication, CMTRT. Correct. The same thing here will come, which is nothing but here EXTRT, which is nothing but name of the treatment. What is the name of the treatment? Right. Then we discuss more about this in the variable definitions. For now, just go with the identifier variables, because this is the constant drill that we do. So the identifier variables are going to be, there are plenty of identifier variables will come to this, right? The first one anyways is going to be study ID. That is your study identifier. Then you have your domain. Then you have your unique subject ID. So just like the sequence number there, here also you have a sequence number, EX sequence number. You have a group ID there. Here also you have a group ID, EX group ID. In addition to this, we also have EX ref ID, the reference ID. Up to this is pretty much same as your MH domain, pretty much same as your AE domain, pretty much same as your concomitant medication as well. Up to this is same. Now, two additional variables will come as identifier variables, and those additional variables are going to be EXSPID. You also know this sponsor defined identifier. Then EXLNKID, which will be called as link ID. I'll explain this. At the same time, EXLNKGID, that is link group ID. Okay, so these two are the additional variables, but all these are treated as your identifier variables. Plenty of identifier variables, but no worries, we'll discuss all of them one after other. So now we'll go with the variable definitions. So the variable definitions, can I copy from the other domain? Where it is? Yesterday only we discussed concomitant medication, right? Let's take that. From there we can copy the data. So variable definition, study identifier, unique subject identifier, concomitant sequence number, group ID, sponsor defined identifier, up to the second copy. All of them are going to be the same. Correct? So study identifier, it is defined in your protocol. Domain two character long domain abbreviation for your domain, which is nothing but your EX here. Unique subject ID, derived variable, which is going to be done based on these three different variables: study ID, site ID, and the subject ID. So you have a sequence number. Sequence number will be defined for your any sequence number based on your subject ID. You're going to do it at the end. You're going to have a group ID used to tie together a block of related records. The same thing will come to the picture. Then you have something called your EX SPID. The SPID is nothing but your sponsor defined one. It is going to be like your line numbers in your treatment pages. Am I correct or not? Up to this, everything is going to be the same. So I'm just using this same data as is. You also have the reference ID here. Let me take the reference ID. Don't we have the reference ID here? We haven't write it. Okay, let's take it from AE. A reference ID. So it can be any internal or external identifier. So primarily it can be give your details there. I also give you the examples of what kind of data you can have it. So this is going to be EX reference ID. It can be internal or external identifier. Some of the examples are going to be. So if it is going to be an adverse event, it is going to be like life-threatening, death, all these come to the picture. But here it is all about the medicine, right? So the reference IDs for the medicines are going to be, what is going to be your bottle number? You might be using an injection bottle, correct? Or what is going to be your kit number? So you might be using a specific kit for the patient, right? What is going to be the kit number? Or it can be any label, any medicine label, correct? All these are going to be the chances for writing your details. So it can be of your medicine label also. So what we have done here, we just have discussed about few things. The discussions are going to be, that can be any reference ID. Let's say group of patients are taking your what to say, Covishield injection, Covishield vaccine, right? The Covishield vaccine, the bottle numbers is mentioned, right? Or it is going to be some kit number. You can mention the kit number, or whatever is mentioned in the label of the medicine, you can do that. So all these are going to be the valid ones. Clear? Any questions so far? Easy, right? Direct values only, right? Okay. The next thing that we are going to do is we are going to talk about something called link ID. What is that? We are going to talk about link ID. So here I can copy this. Anyone can tell me what is called your link ID? Any guess on this? Anyone can guess on this? What is called your link ID? Guys, what is called your link ID? Team, I need some answer. Just I'm asking a wild guess, nothing more than that. I'm not asking anything, just a wild guess. Might be phase related. This is from Priyanka. Okay. Anything?
Related to records across domain.
Wonderful. Wonderful. Who is this? Sorry.
Raja.
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 Oh, right, right. Wonderful, Raja. So a correct one. So it can be simply, I can call it as a link ID. A simple a link ID. What exactly it will be? I can say that it is an identifier which can be used to link related records. It can be used to link related records across the domains. We generally deal with multiple domains, right? So there is going to be a link between one domain to other. So that link we are going to establish there, right? So what is the link between this domain to the other domain? Now, if you call that particular link group ID, so every link is going to have some group ID, right? So if I talk that particular group ID, that will be call it as link group ID, right? This is something like, I can take the same one here, right? Used to link a related, I can say group records, grouped records across the domains, right? So there is already a group created in the other domain as well. So all these are related to that particular group. So you can link with this domain with the other domain. So how one or more domains linked with each other, that particular information you are going to get it here. Is that clear? Right? Try to guess, guys, because by this time you are already of 10 domains old. 10 domains old. So it would be like easy for you, or it would be like, I think you should be able to do this. You should be able to guess this at least. Okay. So now let's go, because we're done with your all the identifier variables. Now we will go with your focus variable, which is nothing but EXTRT, that is a topic variable, which is nothing but your name of the treatment, right? So I told you this is going to be a topic variable, right? So what exactly it is going to be? Can I say that this is nothing but name of the protocol specified study treatment? Am I correct or not? Because we have been discussing about it. It is going to be a protocol specified study treatment. It is not the treatment, other treatment, because concomitation also, it is also going to be a name of the treatment only. How it is different then? It is a protocol specified study treatment. Okay, then dosing period observation. Okay, the dosing period observation, why I'm not telling is like, okay, if I want to extend this, I can extend like this. It is a protocol specified treatment, right? Also, during what interval we have given this? So we have a dosing period, right? That is nothing but for how long or between what start date and the end date I need to provide this particular treatment to the patient. That is nothing but your dosing period, right? So that dosing period also you need to mention. Say a protocol specified study treatment given during the dosing period. Maybe I can say that. Given during the dosing period. All right. Then from here onwards, again, I'm going to copy the things. I can simply go to the yesterday's one. So we have CMCAT and we have CMSCAT, which is nothing but here it is going to be EXCAT and EXSCAT. So which is nothing but medication or treatment category. Here it is going to be subcategory for the medication or subcategory for the treatment. No medication will come here. It is only going to be treatment category and subcategory. Right? Again, we are going to talk about the dosage information. Let's go to the dosage here. From here to frequency, maybe I can take up to this. So now I'll start with CM dose is nothing but EX dose here, which is nothing but amount, or your what is nothing but your X dose, that is nothing but dosage of your treatment, or I can simply say dose per administration. Then I'm going to have the dose description, then I'm going to have dose units, then I'm going to have dose form. So the dose form is going to be how the dose has been taken, either it is a tablet or lotion, all those things. Then I'm going to have dosage frequency. The same dosage frequency will be applicable here. CM dosage treatment we don't get here because the total treatment we don't get. Then I'm going to have my dosage regimen. This is also will be there. Intended dose regimen will be the same. Then I'm going to have X route. What is going to be the route of administration? The route of administration, again, it is going to be oral or intravenous, all these things the same. So what we have discussed, we discussed about the category, subcategory, then we discussed about the dose, then we discussed about the dose description, then dose units, then we are going to discuss about dose form, then we talked about dose frequency, then we talked about intended dose regimen, then we also talked about what is the route of this particular treatment. Because why I haven't discussed this, all these we discussed yesterday only. All these are going to be the same. That's the reason I just talked about it. So yesterday we talked about the concomitant, other than study treatment. All these are related to the study treatment. That is the only difference, right? What method or what medicine or what treatment that we are taking is different, but rest all going to be the same. That is the only reason I simply copy paste the data from there and continue with this. Is that clear? So now X lot. So EX lot is nothing but lot number. So we are going to assign some lot number. We means sponsor is going to assign some lot number. This lot number is nothing but what is the intervention product lot number? Lot number of the intervention product. From which lot we are taking it. Then we have EXLAT. The EXLAT stands for laterality, meaning I can say that location of your intervention. Location of your intervention, meaning are you giving this particular drug on your left side or on your right side, right? Like this. Some of the examples are going to be left or right. Where exactly you are giving this? All right. Then we have EXDIR, which is nothing but directionality. So what do you mean by the directionality then? Is it going to be a lower one? Is it an upper one? Or is it a proximal? Or it is going to be anterior? All these things are going to be I can say that it is going to be a qualifier for anatomical location. So annotation you are going to do, right? That annotation location. Okay. So the examples are going to be, especially this, we are going to do it for any specific cut or any specific minor surgery. For that, these values are very important. This information is very important. Some of the examples which we can easily understand is going to be, is it a lower one or is it upper? Or are you doing this based on some proximal, like this? You can take some of the examples based on the directionality. Some of the medicines you need to take it only on the fasting. The best examples are going to be a diabetes one, or anything that you are taking for the thyroid. All these, most of the cases, it is going to be based on the fasting status you are going to take this particular medicine, or anything which is related to your gastrointestinal, right? Something like Pandy, all these tablets. Before you take any other medicine on an empty stomach, you need to take this. So for these, you need to understand what is the fasting status. So that is going to be a EXFAST. So nothing but fasting status. So here we are going to take the control terminology, because we go with the control terminology here. Let me take some of the control terminology. Let me copy paste this. Here it is. It's going to be S, or it is going to be no. Okay. Then sometimes you need to adjust your drug. Let's say we are giving the some dosage drug to the patient, but for some reason patient is not able to cope up with that particular one, right? Maybe the patient is getting heavy sweating, or the patient is feeling some nausea, or the patient is feeling too much of hungry for eating the food, right? All these things may come because of the excessive dosage. Some cases, for some patients, not for all, for some patients, we may need to adjust the drug dosage, right? So in that particular cases, you need to record that. You need to clearly mention why we are doing this. So that is mentioned under reason for drug adjustment. Reason for drug adjustment. We need to specifically, you need to give why, the explanation that you need to provide, or you can say that reason or explanation, right? Explanation for drug adjustment. Why did you adjust this particular drug? You need to mention that. So this, you all know, approach. Approach is all about, there is no other thing. Approach is always going to be approach only. That is nothing but trial approach of the exposure recorded. When this particular exposure is recorded, so during which approach, that we are going to hear. Okay, so for an example, it can be treatment phase, right? Or it can be during the follow-up. It can be any approach, right? Any phase of the approach, you can do this. So what exactly is going to be that, we are going to discuss under the. Now we enter into the dates part. So the date part are going to be here. Let me copy paste the dates parts again. From here, I can take this up to duration. I can take happily. So what are them? So first we'll go with exposure. This is going to be exposure again. So start and date of the medication there. The same thing is going to be here, but instead of the medication, you are going to have the treatment. Start and date of the, start date and time of your treatment, end date and time of your treatment. Correct? Then when it comes to the study day, anyone? EXSTDY, the study day. It is going to be study day of start of treatment. So study day of end of treatment. So now this I'm going to replace with this particular one. Correct? Then the CM study day, it will be replaced as EX study day. That's all. Now I'm going to have EX end day. Same thing. Let's replace this here. Then I'm going to have EXENDTC. Copy this. Done. So I'm going to have EX duration of your treatment. So collected duration of the treatment episode. Right? You're not going to derive it. Purely you're going to take it from here. Purely you're going to take it from here. Which one? CRF only. If it is mentioned in the CRF, as is you're going to take that particular. Questions? Any questions on this? Okay. So two new variables that we are going to discuss apart from your uh, concomitant here, those are going to be EXTPT. The EXTPT stands for planned time point name. What is this? Planned time point name. What exactly it is? It can be the planned time point name is nothing but it is going to be a text description of time when administration should occur. So remember, this is going to be a character variable. We also have a numeric variable for this. So let's understand this. The first thing that you need to understand here is it is a text description of time when administration should occur. You need to say when you're supposed to give this particular. Okay, there is a question from who is this? Priyanka Reddy. Can reference start date and time and your X start and date and time will be the same? There are chances it can be the same. Yes, it is same. Not okay. How to explain this? Let's consider Covaxin. You want to go for a vaccination, or let's say you want to have some treatment. Let's say you're not well, you want to have some treatment. Whatever the treatment that you want to have is going to be a study treatment. Let's say that. In that particular case, your study treatment start date and your reference treatment start date, both of them are going to be the same, right? Let's say you're having fever, or the medicine that actually the study drug that you want to have is going to be a fever drug. So you take the fever drug today. So your reference start date and time is 1st June 2022. Your exposure start date and time also the same. Both of them are going to be the same in this case. Let's say your treatment supposed to start today, that is 1st June. But yesterday night, you are not well. You are having too much of vomiting. So then your clinician or your investigator suggested that from tomorrow your treatment is going to start. Right? You need to take the medicine, the fever medicine you need to take, but you are not well today. So what I'm suggesting to you is take this particular pill and have it. This will control your vomiting sensation. Your exposure treatment start date is going to be 1st June, but your reference start date and time is going to be 31st of May, because you have a supporting treatment. You already taken the supporting treatment before you start with your study treatment. So your reference start date and time will change. Is this understandable, Priyanka? Your exposure will talk about the study treatment. Your reference will talk about any treatment that the subject has taken. That can be a study treatment most of the times. If the patient requires any supporting treatment before the study treatment, that treatment when you have taken, that will become your reference starting. Wonderful. So this is going to be text description of time when administration should occur. Means when the drug has to take, when the study treatment has to occur, that details in a character format we are going to keep here. Right? Sometimes it can be a elapsed time interval also. It may represent as a elapsed time interval or elapsed time relative to some fixed point. Elapsed time relative to a fixed reference point. What do you mean by this? Let's say your reference point is today. So from today or from the first dosage, after 24 hours, the second one should go. After 48 hours, third dosage should go. After 96 hours, fourth dosage should go. So your fixed point, that is today, from today, you're elapsing, you're counting the number of hours, you're counting the number of days, and those you are representing there. Am I correct? Right? That is what I'm talking here. That is from the first dose to at what time you are going to take the next dose. From the first meal, after how many hours you have to take this particular one. After your last meal, before your last meal, how many hours you need to take this particular one. Those details will be represented here. Planned time point meal, that is XTPT. It is a character one, right? This one you're putting in a character, right? You cannot sort it, correct? Sorting is difficult. If it is a number, it is easy. So what we are going to do now is you're going to have a numeric format for this particular one. That is nothing but your EXTPT num. Num stands for your numeric, right? Purely for the coding purpose, purely for the sorting purpose, you are creating this particular one. So what is this variable? Again, it is going to be a planned time point. Instead of the name, it is going to be number, right? So why do you need it? It is going to be a numeric version of this. It is a numeric version of your XTPT. Why you do this? Helps us when we need sorting, because it's a numbering format, right? Number format, easy to sort. Clear? Right. Now, already we are talking about the time references, right? Now you have one more thing, which is nothing but EXTPT, the same one, REF. The REF stands for your time point reference. The previous one is going to be a regular planned time point, right? This is going to be a time point reference. It is in a character format. What it is, that is, you have your reference number, right? From the reference number, or it is going to be name of the fixed reference point, name of the fixed reference point, or I can say that okay, maybe I can give you the examples that will help us to understand this easy. Examples. So previous dose, from the previous dose, when you want to take this. So I'm just giving a reference of when the next dose has to take, or what is going to be a previous meal. From the previous meal, after how many meals you want to take this, after how many hours you want to take this. Those details will be given in the one. Clear? All of you are able to understand this, right? Questions? There are two more. There are two more are there. Maybe I can complete this. Let me take this. So EXELTM. E stands for elapsed. EL stands for your elapsed. TM stands for your time. So it is going to be planned elapsed time from a reference point. What is your reference point? Time point reference. You have your time point reference here, right? From this one, how many days, how many seconds, how many meals, that information you are going to give. Yeah. This is supposed to be a character format, and the format is going to be IS 86 ISO 8601, either DA or DT. Most of the time it is going to be DT. So this is going to be, you're going to calculate elapses. That is, elapse is nothing, you're going to calculate from the time point reference, how many seconds, how many hours, how many minutes, those data will be under EXELT. Yes, that is nothing but elapsed time. So the last variable under your exposure domain is going to be EXRF-DTC. What is that? EXRF-TDTC. Time reference, right? So this is going to be a simple one, date or time of reference time point. So this is going to be a fixed reference from your this one. From this time point reference, you are going to get, right? Let's have a look at few of the examples so you can easily understand it. Maybe you will be having little confusion around the last 5 data points, but we'll look at the data. I'll show you the examples, then you can have a full clarity on this. Any questions on this particular one, guys? Easy domain or a difficult domain? What do you think? Wonderful. Cool. So tomorrow we will go with exposure as collected. So we also note down all the variable names there. Almost everything will be repeated, but you're going to have some extra variables there. We'll complete it. Then we can go with the examples together. Clear? So I'll share this particular notes. Yesterday notes also haven't shared it, right? So both the notes I'm going to share it right away. Any questions from anyone? Can I have a quick confirmation? All of you are able to follow this? All right, everyone. Thank you. Please tell how to write coding exposure. We will. For everyone, see, we have written the coding clearly only for the AE. So tomorrow I'll complete exposure. Day after I'll go with the substance. So it will be by Friday. By Friday we will complete up to this. Then Monday we will take the DM domain, complete coding from the start to end. Then we'll go with the exposure and EC. These two I'll explain. So by coming Wednesday or by coming Tuesday, all of you are well versed with the first 3: special purpose, events, and also your information. Then we'll go with the findings, which is nothing but laboratory and all, then try the same. Right? Perfect. Any questions from anyone? This is one of the good read. Maybe I can give you find. Okay, I'll share some of the PDFs, guys. Those will be really interesting. Just go through that. So yeah, I'll share this.